Welcome, everyone. Thank you all for joining us this month. This is the November PFCC Partners Workshop. I'm very excited to see so many folks joining us this afternoon all across the country in different roles. We really appreciate all of you being here with us. I am Lindsay Galley. I'm the Director of Education for PFCC Partners and your facilitator for this workshop and all of the workshops as well. I'm very excited to have Nancy Clifton Hawkins join us. She is the Senior Manager of Community Benefits at City of Hope and is going to talk to us today about maximizing community health needs assessment to support communities. We will introduce Nancy a little further in just a moment. I wanted to really quickly just share some tips for using Zoom today. I'm sure we are all very, very used to using Zoom at this point. But we will have plenty of time for questions and discussion at the end of our session today. So as Nancy presents, if any questions come up, please feel free to put those in the chat box. During our Q&A, you can also come off of mute and ask your question as well. You can let us know that you would like to come off mute by raising your hand. All of those buttons can be found on your Zoom toolbar if you hover over your screen. And the raise hand button can be found by clicking participants. So at the end of our session, we'll have plenty of time for conversations and questions. I really appreciate all of the questions that we got through the registration as well. So we'll have time to get to those. But if you have any more, please bring them up in the chat or at the end of our session today. And now I would like to introduce Libby Hoy, founder and CEO of PFCC Partners, to quickly introduce our organization.
If I can find my mute button, I would do that, Lindsay. Good afternoon, everybody, and happy Friday. Welcome to our workshop today. I share Lindsay's enthusiasm and excitement for this conversation with Nancy. She's so dynamic and passionate about really reaching into the communities, and I think you'll find her approach enlightening and energizing and motivating. So I am the founder and CEO of PFCC Partners. We're a national patient-driven organization with a small vision to reinvent the health system through partnership. We really believe in those three gears working together: patients and families, clinicians, and the health system at large, to really produce the sort of policies and programs and research and evaluations that improve the quality of life and the quality of outcomes for all people in America. So welcome again, and with that, I'll pass it back to Lindsay.
Thanks so much, Libby. I appreciate that introduction. And I did also want to say you can see our faces. I don't see a lot of faces, but please turn those cameras on as well so we can see everybody. Look, there's Mary in Hawaii. All right. Thanks again, everyone, for joining us. And we'll go ahead and get started. I am very excited to welcome my new friend and now community benefits mentor, Nancy Clifton Hawkins. Nancy really is a positive change agent within the communities and also a seasoned public health professional. She really, as I have learned, has a passion for helping people and communities who need it most. Nancy is, like I had mentioned, the Senior Manager of Community Benefits at City of Hope in Durante, California, and we'll be talking to us today all about maximizing the community health needs assessment to support communities. So with that, Nancy, welcome. I love your backdrop behind you as well, Garden of Hope. That's beautiful.
Thank you. So I'm going to set this presentation up and let you know I'm aware that I've got hospital folks on the line and that I've also got community members on the line, and I'm going to try and find a balance between the two. But as Lindsay said earlier, if you're able to put questions into the chat, and I know we got questions ahead of time too, I'm hoping to be able to address them, but if I have not, Lindsay's going to let me know. But the main part is my goal is to really get everybody to understand that community benefit is not a solo job. You know, addressing the needs of our community, you need everybody to be a part of it, much like the gears that Libby just shared with you for PFCC. If we're going to truly address the issues of health inequity, systemic racism, we need to do it through a lens that's provided to us through the health needs assessments, and also be able to leverage the relationships we have with one another to become successful. So with that, let me go ahead and move ahead. So Lindsay, you have control of everything, right? All right.
Yes, I
So
do.
the reason why, I'll just kind of click like this, or, you know, say click, and you can go ahead and move them on. So why do a community health needs assessment? Well, let me just get the dirty part out, right? It's federally mandated. And honestly, most hospitals wouldn't do it unless it was federally mandated. And so when hospitals were first granted these nonprofit status in exchange for doing good work in the community and addressing needs of the vulnerable to prevent the government from having to open up another federally qualified health center, for example, hospitals said they would do it. But the truth of the matter is hospitals did not do it. In fact, what they did instead was they did a lot of their work where it focused on the external areas away from, say, like urban hospital settings. So they created effectively a donut hole. And they only went out to the areas that had money to pay for services in the hospitals. And the federal government was just like, no, that's not gonna do it. That really doesn't help us address the needs of the vulnerable in your service area. So you're gonna have to do a triennial community health needs assessment, because then what's gonna happen is you're gonna be able to find out what the needs are of the vulnerable living in your area. And you're going to have to do something about it. And so they created the whole aspect of doing this together to be more accountable to community benefit. Do I have another bullet point on there? Oh, there we go. Yeah, pull them all up. So if there are bullet points, just pull them all up, Lindsay, okay? Because I've forgotten what's on the slides already. So when you acknowledge the community needs, and then we have to prioritize those needs together, and then we have to develop those strategies in order to address those needs. Because before, the hospitals did the needs assessment, and then they put them in the little folder and put them away, never to be looked at again, right? But with the federal mandate, they are forced to take out the file. They are required to work with their community members to strategize those needs, and then tell everybody in the community what they're going to do to address those needs. And then after that, report on that annually so that the community members will be able to, that's not for me, is it, Libby? Chat your role and where you're calling in from. Okay. Okay, everybody, Libby's in Long Beach today.
Yeah, ignore the chat. We can manage that.
All right, I'm gonna ignore the chat. Anyway, so this is why we have to do it, and it's really terrible, because I would hope that doing the needs assessment would come from a more altruistic place. But it does not, but that's the public health in me, all right? But the fact of the matter is we have this, and we're gonna have to do it, and that's why we're all together in this call today. So next slide. So in our effort here in the San Gabriel Valley, I just want to give you an example of how we've been able to maximize our efforts on this federal mandate. You know, we started meeting a few years ago because we realized that our strength and our ability to do more along the lines of the needs that we've assessed is if we work together. And in the San Gabriel Valley, there are 5 nonprofit hospitals that include, and I'll tell you who they are. It's Kaiser Permanente, Baldwin Park. It is Emanate Health that has 2 hospitals. It's Arcadia Methodist, Pomona Valley, Huntington in Pasadena, and then City of Hope is actually, if you haven't heard of it, is a cancer hospital located in Duarte. Our service area for City of Hope expands the entire San Gabriel Valley, and if you were to talk to leadership at our hospital, they would say the entire world is our service area. But for the intensive purposes of today, we're just going to talk about the SPA 3, which is our special planning area that the health department uses, and all those hospitals that are included in it. But imagine this, you know, a bunch of hospitals get together, and can you flip it to the next slide, please? Okay, here they all are. So all of our hospitals, we get together and we are doing our needs assessment at the same time. Well, because geographically we're so small, can you imagine all of us going through and going to the same organizations over and over again and doing key informant interviews and focus groups? It causes a lot of fatigue in our vulnerable communities. And also, in a way, it erodes the trust and respect that we have in those communities, because also hospitals don't even go back and tell the groups what they found out about their communities. So this was a way to bring the hospitals together, share the data across the line, reduce the fatigue of our different focus groups, but also expand the actual number of community focus groups that we have. So each hospital moved from just having 5 focus groups each to we had 25 focus groups across the region that we would be able to draw from to color in the data results. So next slide, please. So keep going, just put them all on there. All right, so this was everything that I just talked about. But most importantly, we wanted to be able to take all the data that we gathered and pinpoint some of the higher indexing issues that came across in our vulnerable communities. And then we want to work together to address those issues together. So for us, we're looking at food insecurity, recuperative care, and mental health issues. So next slide, please. So before I jump into the details of all of the data and the things that we found out, I think for perspective, it would be really good for all of you to take a moment to watch this 4-minute video, because I think it'll make a lot more sense for the second part that I'm moving into. So Lindsay, if you don't mind.
What determines how long we'll live? Is it what we do? Is it who we are? Actually, when it comes to predicting how long you'll live, your zip code is more important than your genetic code. Here's how this works. Meet Deb and Maria. They both have jobs, they're around the same age, they're both married, and they both have 2 kids. Deb lives in A-Town, while Maria lives in Bville, less than 1 mile away. They're similar in so many ways, but here's the thing. On average, residents of Bville will die more than 15 years sooner than the residents of A-Town. Why? Because where you live is about more than just your address. It's about your opportunities. For example, Deb and Maria's access to healthy options is really different. In A-Town, Deb's family is surrounded by healthy food options, including farmers markets, specialty shops, and grocery stores. The air in A-Town is cleaner and fresher, and there are lots of safe, clean parks where Deb can exercise and her children can play. A-Town has good public schools for Deb's kids and easy access to emergency and preventive health care. On the other hand, Bville has broken, badly lit sidewalks, and the parks are unsafe. The air is filled with truck exhausts from the nearby highway. And for food options, Maria's only choices are Bville's many liquor stores, fast food places, or convenience stores. The schools in Bville are overcrowded and undersupported. And even if Maria can get her kids into better schools far away, she needs to figure out how to get them there without access to a car. So for Maria, having to juggle so much to find healthy options can be an overwhelming source of chronic stress, which is a serious health risk factor. In fact, for all the residents of Bville, chronic stress drives health problems like obesity, diabetes, asthma, and heart disease. How did A-Town and Bville get so different? Well, in many cases in cities and towns across California, the root cause was racial and economic discrimination. Over the generations, poor white people and people of color were pushed to less desirable parts of town, where banks refused to lend money, businesses left, jobs too, schools declined, and the neighborhood crumbled. Everyone who could move away did. And what's more, when communities like A-Town and Beeville are so unequal, Beeville isn't the only one that suffers. Because it turns out that not only is your zip code a predictor of how long you'll live, so is what country you live in. Countries with the greatest income inequality have the lowest life expectancy. So even Americans like Deb, who are white, insured, college-educated, and upper income, die younger than their peers in other countries. In fact, our life expectancy is 43rd in the world, and that number is slipping. In the end, our biggest health risk may actually be inequality, and extreme inequality hurts us all. So what do we do? Well, if we're all going to be healthier, we don't just need to help the folks in Beeville beat the odds. We need to change the odds for everyone. And that's what we're doing. There's a movement happening. We're Californians. We don't follow. We lead. We are building the power to make health happen in communities across the state. We are coming together to build one California, a smarter, more inclusive and equitable state that creates health and opportunity for all of us. Join us. To learn more, visit buildinghealthycommunities.org.
Thank you for that, Lindsay. I always get chills when it says, we're Californians. We do things differently here. And I realize a lot of you aren't from California, but that's just a little sense of pride that I have in there where that goes on. And George Takei, he just is a great speaker that narrates something that's critically important. And I hope that it was able to illustrate for all of you the differences in the zip codes, and I'm sure many of you have heard it before, that play a difference in how one person has more benefit versus the other. So on the next slide, I want to show you all how this kind of looks in Duarte, or in where I live. What you're looking at is basically a 10-mile radius between 3 cities. We've got the city of San Marino, the city of Duarte, and the city of El Monte. What you see there is that the income in San Marino is $152,000. But if you go almost 10 miles to the east to Duarte, that drops to $71,000. And if you go south 9 miles to El Monte, that drops even more to $43,500. And so there's a lot of really interesting things that play when you do a needs assessment, because what happens is you may see, you know, what you think is going on in your community, but it brings out the data and it addresses more of the personality that makes these communities so diverse. You'll see the cap on there in relation to graduation. 9.1% of the families in Duarte do not graduate from high school. In San Marino, it's 2.1%. In fact, they have a large percentage of folks that actually get master's degrees, which is interesting. But down in El Monte, 26.7% of the families do not have a high school diploma. Break that down even further with linguistic ability, and you'll see in El Monte, look at the differences in their languages. 27% or almost 28% speak English, 16% speak Vietnamese, and 55% only speak Spanish in their home. Compare that to Duarte, where it's 45.6% English speaking and 36% Spanish speaking. But over on the other side, where you see San Marino, it's 40.5% of an Asian language, which really is predominantly Mandarin, and then 47% English. And the reason why these numbers are always so interesting when I think about the communities that we work in, is because just because San Marino has a high income and a high rate of graduation from high school, doesn't mean that they also don't have particular barriers to healthcare as well, especially because of the linguistics. So when you think about, you know, a higher income person, it doesn't necessarily negate the fact that they're not experiencing health disparities. And so don't discount it just because of the income level in particular areas. Dive into it, get curious, and walk around the neighborhood. One of my most favorite things to do, and people in my office crack up at me when I do it, but I get in my car and I just start driving the neighborhoods, and it's absolutely fascinating for you to take note of the fact that there aren't more liquor stores and more fast food restaurants in our poorer communities compared to our communities of greater wealth. There are more proximity of those places closer to schools or closer to high density apartment buildings. So just get curious. Don't just stop at those statistics, but dive in and really explore what's happening in your community. So the next slide, please. So with that being said, the things that we found out in our community health needs assessment was that these were the usual suspects that come up from year to year, although the categories have changed slightly. And the things that really have bubbled up higher are more intense. So things like housing insecurity and homelessness would have never come up on the radar before had we not really addressed more of the social determinants of health within the context of our assessment. And that was something that we really wanted to be sure that we did. Because of addressing social determinants of health, not only do we find out more about the health issues that are coming to bear on our vulnerable communities, but we're seeing things like access to care. And I want to let you all know that access to care here that we discovered later on with our community members has nothing to do about having access to, you know, a healthcare provider. I don't know if you all know, but I mean, in California, everybody has access to healthcare. And so when you have access to healthcare, people might say, well, there aren't any barriers. But what we discovered in our focus groups is that there are incredible barriers related to the way that our patients perceive their care. And it's all based on racism, a sense of poverty, and so forth. And I'm going to talk about those later. But when you look at these points, you're like, wow, that's a lot. How can one hospital, a specialty hospital, and some of the other community hospitals really deal with all of these issues? Well, I'm here to tell you, you don't have to aim for all of these. You need to think about, you know, what is your capacity as a nonprofit hospital to carry out some of these, and in order to do that, bring them all together, take all the data that you find out and prioritize them. And that's what we did. So next slide. So I have a community benefit advisory council that is made up of individuals that represent the vulnerable communities that we serve in the San Gabriel Valley. And we task them with taking the data that we reported back to them and ask them to really think about, you know, how many people are affected by these issues? What is the seriousness of this, or to the degree to which the problem leads to death, disability, and impairs a person's quality of life? What are the social determinants and the root causes? How is there equity? Are there specific groups that are more affected and impacted by this than others? Is it really feasible for us to think about our hospital diving into some of those issues? You know, what is the value in the intervention? They really had to think about all of this stuff. And this is what it looked like when we did it. So go ahead and show the next slide, Lindsay. So these are members of my Community Benefit Advisory Council, and they represent a huge swath of the community. But the pictures that you're seeing here is once we gave them those parameters, I took all the categorical areas and I put them up on the wall. And I asked them to please rank them as their number 1, number 2, 3, and 4th priority. But in addition to prioritizing them, I wanted to hear more about what they had to say. And so they talked about it, access to care. And by the way, transportation is always noted in ours. Every single year, transportation comes up when we always talk about how are we going to address those issues. So with that being said, on the side, our community members said, hey, access to care, it's not really about getting care anymore. It's about implicit bias. We need to look at policy, systems, environments, and create our own collaborations to address them. And then they went across the line to all of them. And you'll notice they combined categories like mental health and substance abuse. And they did chronic disease, but they put in obesity and being overweight in those same categories. So when you are looking at the needs, think about what makes the most sense on how you can categorize them so that you can best create a system to address them. So the next slide, Lindsay. So for us, what our Community Benefit Advisory Council did is they took all of those bullet points and they turned them into access to care, mental health, economic housing and security, chronic disease, and cancer. And what that means is now that I've got these, they're basically my marching orders as the Department of Community Benefit. My job is to create the strategies, leveraging our community partnerships, to make sure that we're dealing with each and every one of these issues. So for example, with access to care and economic and housing and security and mental health, we're really, well, actually all of them. One of the big things that we're doing right now is looking at systemic racism and how that's impacting services, not just on the outside, but how do we look at that beyond, you know, having a healthcare team that looks exactly like their community. It's about teaching your healthcare providers also how to work with a very diverse and vulnerable community at the same time. For example, a hospital may want to increase their services for transgender individuals, but if you don't have a staff member who understands how to deal with the transgender community and how to provide them adequate and equitable care, then that's a complete loss for you. You know, you need to really think about how you are intentional to address these issues in your community. So with us, economic and housing and security, we're doing a lot of stuff around food insecurity right now. We're assessing the needs, and we've got those community sides going on. But we can't make connections of our internal community to the external community until we have our house in order as well. So we're now leading with all the other nonprofit hospitals an opportunity to create food insecurity policies and pathways to get to care in the in our local community. And we're developing these systems and strategies to touch on each of these. And by the way, you know, it's not always me. Sometimes it's about, you know, with chronic disease, we have a Healthy Living Grant program where we are designing interventions that support all of our community organizations that have the expertise in the broader community so that we can invest in those communities and provide them with the opportunity to reduce the disparities for the communities that they particularly serve. So next slide, Lindsay. So I always like to ask people, you know, how do you engage the hospitals? Or the other way to say it is, well, now that you know what you know, what are you gonna do? Right? So if you're able to go in and look at the community health needs assessment, which you all should be able to do, community health needs assessments have to be posted on each of the hospital's websites. And by the way, hospital folks, remember, you need to find some place that's easy for your community members to find that CHNA. And community members are allowed to provide their input and to talk about that with you. So make yourself available. So you need to listen with everything that you're learning. You need to intentionally reflect on what you've learned. And then from there, seek out those connections. Remember, our success is not working vertically. We really need to work with each other and connect what it is that we're doing with each other so we can create, well, we do a lot of talk and we talk about it here in the San Gabriel Valley, but a systems approach to change. So a regional systems programming that helps us address the social determinants in health, that allows us to connect with other organizations and city governments and health departments and other hospitals so that we can leverage each other's resources and make a difference. So once you connect with everyone, have a dialogue, right? What makes the most sense? How can we make this happen? And then act on it. I don't want any of you to come away from your meeting saying, oh, wow, that was a really, really great idea. And then leave and do nothing about it. Because I can tell you this right now, if you do nothing about any of this information that you've learned from me or you've read in the CHNAs, you have effectively broken the trust that you have with your broader community. The community members are giving you their reflection in the focus groups, in their interviews. They're giving you your time with the hope that maybe something's going to happen. You are obligated to make something happen. And if you don't, you risk losing, you know, what you have in the broader community. So next slide, please. So what you want to do to work this out is you want to contact the person in charge of writing the CHNA for the hospital. You need to tell them that you're interested in getting involved with whatever they're doing in their community benefit or community health improvement programs. Everyone calls it something different everywhere else. Listen to what they tell you, because I'm going to tell you something right now, and I've shared this with Lindsay before. I had a gentleman who had a bicycle safety program, and he wanted me to work with him in the development of bike safety programs out by UCLA, which is way on the other side of where we are. But what the CHNA does and the prioritization does is it kind of gives you an opportunity to say, hey, you know what, that's a really great idea. Let me link you up with some other organizations and other hospitals in that area and see if they can support your work. But for us, over the next 3 years, we are going to be addressing those issues around yours within the context of healthy living, and how are we creating safe environments for people to be physically active. It may at some point include something that has to do with bicycle safety, and it may not. But we certainly invite you to apply for a grant from us so that our Community Benefit Advisory Council members can determine whether or not your project would be something that we should be investing in. So listen to what they say, because your priority may not be the same priority as the hospital, and the hospital may not have the capacity to really support some of the work that you're doing. So, and then finally, I'll kind of move that out of there. Find a way to link your experiences to help them, because the bottom line is, from a community benefit hospital perspective, if you come to me and say you want to do this, I would be interested in knowing what you have to help me, because I'm a department of one person. And while I can get a lot of work done on my own, I'm really more interested to find out what it is that you have that you can help me leverage your support and make a difference in the community. And so be sure to really link a way into the hearts and minds of the individuals implementing community benefit programs at hospitals by saying, hey, you know what? I represent a monolingual Spanish-speaking community. I can provide their perspective and a connection with the individuals in the community to help you move forward. I represent a local organization that provides mental health services to the Vietnamese community, looking at preventing suicides is related to the way COVID has impacted them. And so these are ways for you to kind of link your experiences and move through so that you can help the hospital work towards their goals at the same time supporting the needs of your community. And then finally, I have just one more slide, and Lindsay had asked me before, you know, where do you get this passion from for this type of work, Nancy? And basically, I mean, I always tell people I was just made this way. You know, the picture on the left-hand side of my screen, and hopefully it's on the left side of your screen, that's a picture of my 6th grade class in Long Beach, California. I went to Lafayette Elementary School. This picture, I'm dating myself and I don't care, was taken back in, I think that was 1977. And that's me in the front row, the third from the right. Thanks, Lindsay, for picking that out. So I grew up in a very, very, very diverse community. And so I remember in 2nd grade, I was helping the guy next to me, Jose. I was his ESL teacher from 2nd grade on. And so I was really just brought into supporting and helping communities from an early age. And then the picture on the right is a picture of me when I was serving in the Peace Corps in Thailand. And from there, that launched my career in public health and a passion in serving vulnerable communities for the past 30 years. So that's why I'm who I am. That's why I get excited about talking about these things with all of you. I hope it's been infectious. And so at this particular point, Lindsay, I'm going to turn it back to you, and let's get ready to answer some questions.
Sounds good. Thanks so much, Nancy. I'm always invigorated after hearing you speak because you have such passion for this. We did get a few questions in the chat, and again, we had some submitted before, but I think you did a great job answering some of those through your presentation, so thank you. The first question that we had, I'm going to start in the chat, is from Joe Connell. He says, in California, we have special healthcare tax districts with elected board of directors. Are you aware of such districts collaborating with community health assessments in hospitals?
Yeah, isn't that the effort to use wellness funds that are meant to address particular issues in the community? I think that's what you're talking about, and that's a lot of work that's been going on with the Accountable Communities for Health and the Public Health Institute. We don't have them in the area where I live, but there's been a lot of talk about creating those particular communities to take a bit of the tax dollars, you know, from the region, but also hospitals and things like that, that would go into a pool that basically creates a wellness fund that's supposed to help address those needs that come up in the CHNA. So a lot of people are thinking about that as a way to build sustainability into these efforts, because honestly, you know, once a person leaves a hospital who's been in charge of the CHNA, sometimes they lose the motivation and the ability to help sustain the works of the community. So what you're talking about is one such effort built to build the sustainable and collaborative environment where all the hospitals and school districts and local governments and community organizations can work towards achieving the goals set forth in local CHNAs. So.
Great, thanks, Nancy. And I guess kind of along those lines, one question that we got a lot in the registration was about acquiring funding. So for smaller community hospitals, I'm just curious what your thoughts are on that or experience with.
All right, well, the first thing is, the hospital's supposed to set aside a budget to do it. It's not about them acquiring funds from the grants. It's about what's the hospital giving as a portion of their budget to address the needs that were identified in their CHNA. So the big part of it is really getting executive leadership to recognize the importance. This isn't just some feel-good activity that you're doing to make people, you know, happy. I mean, in part it is, but the institution has to support the funding of these things. And then with that being said, I mean, honestly, you guys, I'll be really honest with all of you. I do a ton of work in community benefit, and my budget is only $175,000 a year. But I'm able to turn that into almost, you know, $2.5 million in investments in our community, because I'm able to leverage people across the institution and get them to do things in the broader community that actually impacts the vulnerable, whether it's education, you know, doing health screenings, and so forth. So I mean, there's a lot of things that you can do to make it happen. So don't just sit back and think I can't do it because I don't have $3 million. If there is a will, there is a way. If you write your plan based on your CHNA, you can budget that out.
Thank you. And then Libby had a question in the chat. Can you share a few strategies for people to engage community members in developing the community health needs assessment like you did?
Yeah, well, I mean, I participate in a ton of coalitions, you know, and that's one of the most important things, because it's about, you know, community benefit is really about relationship building and building your network of safety net providers and community organizations to address needs. And once you have those relationships with all those organizations, they become your natural partners to help engage in the development of the CHNA process. And that's what we did here in the San Gabriel Valley. We engaged all of our partners through the Health Consortium of San Gabriel Valley, or Healthy San Gabriel Valley. And I also engaged the 20-odd members of my Community Benefit Advisory Council that represent senior citizens, LGBTQ, Chinese speaking, Spanish speaking, the local school districts, communities of faith. I mean, bring them all in. Oh, the YWCA, the cities of Azusa, the health department, they're already my natural partners. And so they are along for that ride with me. And so it would behoove everyone really to look at how, one, you can build a robust Community Benefit Advisory Council that represents the vulnerable communities, so you can keep it closer to home. or start to engage yourself in those different collaborative efforts that are going on throughout the region that you can leverage as partners, and invite them at the beginning, like even a year before your CHNA is due, you need to start the work on it. Bring them in the beginning, because there isn't anything that community members disrespect more is being asked to participate in the process after the process has already been done.
Yeah.
Bring them in, show them that you value them and that you need them to help you build something that's sustainable and successful for your community.
Absolutely. Well said. Another question that we got in the registration was, how do you implement the results from assessments into deliverable projects, and how do you decide on project priorities, which you did address with the Community Benefits Advisory Council, but maybe if you could provide us like a specific project that you were passionate about and kind of how that aligned with the results from the assessment.
Sure. So when they prioritize the assessment for me, I need to sit back and really think about, how am I going to go with my little teeny budget and make a difference on these different areas? And a lot of times it's about, how do I support community organizations that are currently making that happen? So, excuse me, what we did is we collaborated with the Health Consortium of San Gabriel Valley to develop a mental health integrative summit, a 3-program thing for healthcare providers and mental health providers, to show them how to integrate healthcare collectively so that we can more effectively address the needs of our most vulnerable communities. So that's one. And so it would be funding those events. And by the way, there's a big difference between funding these initiatives and sponsoring fundraising events and parties and things like that for other organizations. I have very specific outcomes that are linked to my implementation strategy. And so I make the nonprofit organizations that I work with, that I provide the funding to evaluate the program so that I can report back on those in my community benefit report. So there was that. We put on a mental health summit one year. So not only did we put on the mental health summit that like brought up all the issues for everybody to see, but we created community resources there so that when people from the community came to our event, they were able to engage with service providers and link in immediately before they left, whether they were organizations representing a vulnerable community or whether or not they were a consumer of mental health services. We had everything there that represented all the major healthcare providers and the providers of mental health services in the region. The event cost nothing because it's about getting people there and addressing their needs. And then of course, our healthy living grants that we have, we're super, super passionate about that. Again, I mentioned I'm a department of one. How do I make these things happen? It's not about creating something and branding it with the City of Hope name on it. That's not what community benefit is about. Community benefit is not about marketing, but doing good community benefit is good for your brand. I want you always to keep that in mind. So the idea is to invest in community organizations that are already doing the work. And so that's how we're able to address those issues that came up in our implementation strategy. And this year alone, we've funded teenage suicide prevention. We've done food delivery, food insecurity projects that create medically tailored meals for homeless. We've invested in recuperative care. We are working with a high school that has a garden, the Best of Times garden, and they're actually taking their produce and providing it at the meal drop-off or pickup at the local high school so that the schools have access to that, and they're teaching the kids skills on how to create a business out of using that market and how to address a food need in the community. We have worked with local school districts that created pop-up markets for their students, and what we found out at the end of that was that they actually had more people that had food at the end of the month than they did prior to starting this particular program. So, I mean, we have to evaluate everything, because it's not, I mean, it's good to give money away, but for me, if I'm going to give you a penny, I'm going to make you validate how this you use the penny. People don't like that about me, but that's just the way it is. But that way we can make sure that we're moving the trajectory on the things that we've prioritized in that year, and we can report back on that every single year. And if you guys are all curious and you want to take a look at it, go to the community benefit website at the City of Hope website. You can, all my reports are there for you to see, and you can see how we measure and evaluate everything that's going on.
Definitely a good resource. Thank you for that offer, Nancy.
Sure.
I'm curious if the CHNA impacts clinical programs at the hospital or the strategic plan for the hospital in any way.
Yeah, it's funny. I just sent an email out to everyone because they wanted to know, gosh, Nancy, how does your work impact diversity, equity, and inclusion? And my whole comment to that is everything that community benefit does has to do with diversity, equity, and inclusion. And in light of our terrible social circumstances right now with COVID and how it's brought to light the inequities within our healthcare delivery system, now all of a sudden our executive leadership is really looking at how do we create those pathways internal to City of Hope so we can address issues of health inequality or diversity. And some of the doctors are starting to create these committees that are looking at social determinants of health as a way to strengthen the infrastructure at City of Hope to better address those needs. And one of those is that connection with food insecurity I think I brought up earlier is just about, if we're going to link our community members to food resources, then we need to create that infrastructure inside, because you need to have a doctor who knows how to assess a patient for food insecurity. Social work has to, once they get those results, have to have a pathway to make that referral to that community organization. Can we in fact address food insecurity while the patient's either there inpatient or an outpatient visit? Can we provide them with food from our cafeteria? Can we direct them to our food pantry? Can we give them food to take home with them while we connect them with resources? And so these things are very real that are going on right now, and and that is directly linked to our CHNA and those issues related to the reduction of systemic racism and health inequality. And that's just one small example. There are a lot of other things happening in a domino effect down the line, but that is just one for now.
Yeah, and you can definitely see the relation from the community benefits work that you're doing to diversity, equity, inclusion. I'm happy to hear too that it's coming from the clinical side too, because that example alone, that makes perfect sense. Of course, we need our trained staff to be able to support that connection as well. I wanted to just pause and remind everyone, if you have any other questions for Nancy, you can put those in the chat, or you can feel free to come off mute and join in our conversation. So Nancy, we had an interesting question through the registration as well. Someone is looking for innovative software or ways to conduct and display their community health needs assessment. Do you have any information on that?
Well, it depends on how much you have to spend. And thank goodness we live in a time where technology has really helped us out a lot. I can tell you that I work with our marketing department to put up some of our reports and the highlights of things on our website or on our dashboard. And so if you, and take a look at all different types of nonprofit hospitals around the way, see what your marketing and communications department can do for you to help you really bring more visibility to your community health needs assessment. And in the absence of that, I use Vengage, which is like an infographic maker sort of thing, to make my own infographics. I work to create things to put them on social media. I pretty much just go rogue and push it out in the end. But I think if you want it to look really good, that budget for it and go talk to your Marcom department, or see if you can outsource it to a team of people who do graphic design. Because the part that's really interesting about that, just so that you can keep this in mind, is sometimes you get really close to the data. The proverbial, you can't see the forest through the trees. So maybe you're not really seeing the data as the way that it should be seen. And when you pass it off to other folks to take a look at it, especially the professionals, they create things in ways that I would have never considered a way to present the data to the community. And so really take advantage of those networks and fund it and make sure that you can make that happen. So
absolutely. Thank you.
oh.
All right, we have a question in the chat. Oh, about the video that we shared. May we know who conducted that?
Right, that is through the California Endowment. So if you go up on YouTube and you just type in the California Endowment Healthy Communities, they have a bunch of videos in there, and that's where I got that video. It's one of the best that I have seen that gives a shorter view of demonstrating how disparities impact communities. I love it.
Yeah, I thought it was really well done and opened my eyes too. It's a great illustration. And we can share that along with, Nancy, if you're okay with it, the City of Hope Community Health Needs Assessment out in email follow-up to everyone who's attended afterwards.
And by the way, just so that everybody knows, when Lindsay shares the CHNA that we did, the one that sets mine apart from a lot of the other hospitals is I really want you to know how to use the CHNA. So I always have a section above every, I guess, chapter, how to use this section. So it guides you through the process of thinking and visualizing how you might be able to utilize the data and the information to help support your work.
That's really helpful. I'm curious if you can, in the last few minutes we have here, talk a little about the content within the CHNA. I know we had talked about too, kind of like how do we start to build a resource list for our communities and community-based organizations that we can connect with. And I know you had shared that there should be a list of community-based organizations within the needs assessment, but just wondering if you can talk a little more about really the content within it.
Sure. So the CHNA is not just a random document. We actually have a template for what you need to put into it so that you can address the needs of the community. And the Catholic Healthcare Association actually focuses on community benefit, and they're the ones that everybody goes to. They have the guides for what it is that can help you understand what community benefit is, but they also have a guide to show you how to write a community health needs assessment and a community benefit implementation strategy and your annual report. So I just want to put that out there so that you know that it's there. But some of those predetermined points that you need to address within it are in our report. Like you have to do the assessment of all the social determinants of health. For me, I have a larger cancer section in my report because we're a cancer hospital. But to give a shout out to, one of our executive leaders, he said, Nancy, we're a cancer hospital. Why are you trying to address food insecurity? And I said, oh, so-and-so, if you don't address these issues and other social determinants of health, you're going to increase the risk of a person acquiring cancer to begin with. And so really, if you go in there and really create a CHNA that looks at the root causes of some of the more serious diseases and conditions people have, you'll be able to create a really great mapping of what you need to do. Now, how do you connect the community to it? Again, Lindsay, at the back of the report, every report should have a list of all the organizations that participated in their community health needs assessment, as well as other organizations that can help address the need. And so it's simple as going to the appendix of the report and pulling that up. If you do that and you don't see your name on there, call the hospital and let them know that you want to be a part of the next one and that you want to be a part of whatever they're doing for the programming in relationship to community benefit.
And that's another quick point too, Nancy, and I think you might have mentioned it previously, but the CHNA is public and on the website for community members to respond to as well, correct?
That's right. And they should have a name of a person and their phone number and email address or a way to contact them. And that hospital is obligated to get back to you. Now, I can tell you, I haven't really had anybody respond to my CHNA other than asking if they could get a job with me.
Well, because you're doing great work. All right. Well, thank you so much, Nancy. We have a few minutes left, so I wanted to open it for any other questions. Libby, I saw your note in the chat. That's a really innovative idea. I like that. But any other final comments, questions, thoughts?
Well, I'd like to say, Libby, that's a great idea. One of the things that you have to do in community benefit is a lot of stuff around workforce development. And so if you're able to, you know, encourage the hospital to go and outreach to local communities that could provide services, you should. I know that for us, what I like to do is I get my catering done by local nonprofit organizations. A lot of them are through the local high school districts. One high school actually created all the fruit juices that we did for a garden party that we had at work. Another time, I ordered baked goods as a dessert and event from an organization that employs adults with special needs who are the actual bakers. And so really hospitals should be looking at how they're investing in that infrastructure across the community. And if you know organizations and businesses that represent a vulnerable, underrepresented community of color, give those lists to the hospital, because they should be innovating the way that they're doing their supply chain management that's more diverse. And right now is the time to strike.
Absolutely. Great point. Great way to round out this wonderful presentation and conversation with you, Nancy. Thank you to everyone who participated today for your questions and just overall participation. We really appreciate it. We've recorded the session and we'll share that out along with the City of Hope CHNA and the video from today's session as well. But if you have any questions, any other questions for Nancy, you can reach out to me and I can help make that connection for you also. But with that, thank you so much, Nancy, for joining us this month. And I hope everyone has a very grateful and thankful holiday. Take care, everyone.
Thank you.